Hi, welcome back to Everyday Behavior. My name is Dr. Marianne, and this is the second video in our series this month on establishing operations. During this video, we're specifically talking about the establishing operation of sleep. And so with sleep, children require a lot of sleep. This week, for example, I was on my way to work, and it was Monday morning. I didn't sleep well the night before. I have a bit of a head cold, and so I was just feeling very drained. And while I was driving to work on Monday, I just felt like I was in this fog. I was just sleepy. I couldn't really think straight. I was really looking for the nearest coffee shop because I was like, I need some caffeine to get me going so that by the time I get to the office, my brain will turn on and I will be working, right? But I was feeling very lethargic. Well, in children, when they are sleepy, rather than having that feeling of lethargy, they tend to have behavioral agitation. And this is what the sleep paradox is adults are lethargic, whereas children are agitated and hyperactive when they're sleepy or sleep deprived. They tend to move around a lot, they tend to be hyperactive or impulsive, and they have a hard time sitting still, or they engage in poor decision making, as we all do when we're sleepy. And so children also require a significantly more amount of sleep than adults. Now, of course, the general recommendation for an adult is 8 to 10 hours of sleep. However, for children, that recommendation can be as much as, especially for young children, 13 hours of sleep per night. So if a child is only getting 8 to 10 hours of sleep, they may not have adequate sleep to feel well rested, and some of their behavior problems may be due to inadequate, poor sleep. To further complicate matters, sometimes children who have inherent behavioral concerns or biological behavior concerns such as ADHD or autism often have sleep difficulty as part of the neurological impact of their disability. And so children with ADHD or autism often have difficulty falling asleep or they have difficulty staying asleep throughout the night. And when they wake up in the night, they may have difficulty falling back to sleep. If your child has ADHD or autism and has a sleep disability and they're not getting adequate sleep, you may talk to your pediatrician about sleep, and if your child may need a referral to a sleep specialist in order to further evaluate their sleep behavior, or may need additional supplements, vitamins, or prescription medication to assist with sleep disturbances. However, in neurotypical children, when there is not the presence of sleep disturbance, biological or neurological sleep disturbance, you want to make sure that children are receiving adequate amounts of sleep. So on our Facebook page, you will find the American Academy of Pediatrics sleep recommendations. And what the American Academy of Pediatrics recommends is that for children 1 to 2 years, that they get 11 to 14 hours of sleep, including their naps. So if a child, let's just assume that they need 13 hours of sleep, just kind of right there in the middle, 12 to 13 hours of sleep, and they get a 1.5 hour nap. Okay, so that means that they need at night 11.5 hours of sleep. So if your morning wake up time is 7 a.m., that means that their bedtime needs to be like 8 or 8:30 p.m. And sometimes that's very difficult if you have extracurricular activities either for that child or another older sibling. For our children 3 to 5 years, they need 10 to 13 hours of sleep, including naps. Well, if they are in pre-K or kindergarten, they may be getting rest time, but they may not be getting an actual nap. And so that means if they're waking up at 7 a.m. to get to school, they need to be going to sleep at 7 p.m. which if you don't get off work until 5 o'clock, that can be very difficult for some parents to obtain. However, it is important for behavioral concerns that we are getting that adequate sleep. Because if a child's not getting adequate sleep, you may be seeing that during the school day, or especially in the evenings, as they get more and more fatigued, that the rate of behavior concerns significantly increases and they become more impulsive, silly, or agitated. For children that are 6 to 12 years old, they need 9 to 12 hours of sleep. Nothing makes me more frustrated than to drive by a ball field or a soccer field or a football field at 8 or 9 o'clock at night and see people, short people, small people, little people, people that are under 5 foot, your little kids out there on the ball field at 8 or 9 o'clock at night. Those children need to be in sleep or in bed in order to get that adequate sleep so that they are well rested and at school the next morning. Because if a child does not have adequate sleep, they will likely have behavioral problems that can look very similar to ADHD or conduct disorder, oppositional defiant disorder. So some of those behavioral disorders, or they could have difficulty learning. And so some of their learning difficulties or delays in school, lack of achieving benchmarks, could be not due to a learning disability, but to poor and inadequate sleep. For our children that are 13 to 18 years old, they need 8 to 10 hours of sleep. And so that means they need to be getting in bed and falling asleep by 9 or 10 o'clock at night, sometimes earlier, depending on what time their school starts. And so when we're talking about motivating operations, establishing operations, abolishing operations, we really need to make sure that a child's sleep is sufficient so that we're not having that establishing operation for behavioral agitation, inattention, learning difficulties in the classroom. If you have a child in your classroom that is not getting adequate sleep at home due to whatever reason, it may be part of the behavior intervention plan that you need to add in an additional rest or nap time, even for your older kids, sometime during the day, in order to adequately address their behavior in the school setting. So let's talk about when that would be appropriate. If for some reason in the home environment there is conflict or disagreements that's keeping the child up at night, then they may need additional support at home to get adequate sleep at school. Additional support in the school, and you may refer them to resources in the home setting and provide education to the parents so that sleep can be improved in the home setting. So I hope this helps to explain why the important link between sleep and behavior and how sleep can act as a variable that can significantly impact the establishing operations of behavior in the classroom. For more information, you can visit our Facebook page at Everyday Behavior with Dr. Mary Ann. I encourage you to like or follow us on Facebook. I also encourage you to subscribe by clicking the link below to our YouTube channel for additional videos each month as they're released. Thank you and have a wonderful day.